Again, thank you for joining us for this afternoon talking about carpal tunnel syndrome. Really, I want to focus in is all hand pain carpal tunnel syndrome. I am Dr. Kimberly Zambito. I'm an orthopedic surgeon at Mercer-Bucks Orthopedics, and I have a subspecialization in hand surgery. Our key objectives for this webinar is to help you develop an understanding that not all hand pain is carpal tunnel syndrome, and also understand the diagnostic tools that your physician may use in determining whether or not you have carpal tunnel syndrome. And then also to talk about some of the treatment options available to you for carpal tunnel syndrome. I like to begin this with a case illustration. A lot of times when I talk about a case to illustrate it, it helps patients relate, or people listening in to relate to the story. So if your story sounds like this, let us know at the end of the talk here. I have a 52-year-old teacher who has well-controlled type 2 diabetes who came to my office for evaluation of numbness and tingling in both of her hands for the past month. She feels that all of her fingers are numb and that she hasn't been able to get a full night's sleep for 2 weeks. She's tried ibuprofen and Tylenol, but neither have helped. She's tried sleeping in different positions, but that doesn't help. And she has experienced occasional numbness and tingling during the day. And she has noticed when she has this numbness and tingling, if she shakes her hands like this or hangs her hands off the bed, that the numbness and tingling go away. So when I see a patient like this, and again, this was a fictional patient, I do want to try to gain some additional information. What other medical conditions does she have? We mentioned the diabetes. Does she have hypothyroidism? Does she have anything else that might cause numbness and tingling in the hands? I'd like to know, has she talked to her primary care doctor about this? And have they talked about different options in terms of treatment or moving forward and making the diagnosis for carpal tunnel syndrome or other issues? With diabetes, I'd like to know what the last hemoglobin A1C is. That is a measure of your blood sugars in the long term. It gives me a good indication as to whether or not the diabetes is well managed or if we need to work on that as well. And I also want to know if she has neck pain or arm pain, because believe it or not all arm pain is coming from the arms. It can be coming from the neck. So I always ask my patients who come in with numbness and tingling or pain in the arms, do you have neck issues or a history of neck issues? Some other questions that I'd like to ask are, how long have you had the experienced the symptoms? Has this been going on for years? And has she just tried to ignore it? Or if this is something new that's developed in the last few weeks or months? I'd like to know how she describes the severity and the character of her symptoms. If she's noticed some clumsiness or weakness in her hands. What are the locations of the symptoms? For example, if it's the ring in the small fingers, that can be something different. That's a different nerve than the carpal tunnel nerve. If it's these fingers, I'm thinking, okay, maybe it's carpal tunnel. If it's all the fingertips, I'm thinking maybe it's a diabetic issue. If it's the thumb and the index finger, I'm thinking more, this could be more cervical radiculopathy. So the location and the character of the symptoms is really important in helping us to put your story together. Are your symptoms getting better, worse, or staying the same? And what have you done to try to take care of those symptoms? Is this affecting your life? Our case illustration, she indicated that she can't sleep through the night. I don't know about you guys, but if I don't get a good night's sleep, it just sets the day off wrong. Is this affecting her ability to work and do the hobbies that she enjoys doing? The physical examination for carpal tunnel syndrome always starts with the general examination. I want to look at you as a person. I want to see, are you healthy? Are you somebody who has a lot of medical issues? If a cervical spine exam or neck exam is warranted, I'm going to do the cervical spine or neck exam. In the upper extremities, I'm going to look for muscle wasting in your hands, changes in sensation. So I like to compare one hand to the other, and then different fingers to other fingers. that have a different nerve distribution. And then there are specific exam maneuvers that we can do to help evaluate for carpal tunnel syndrome. And if the diagnosis of carpal tunnel syndrome is unclear, there's different testing options that your doctor can use. One of the more common testing options is an electrodiagnostic study, which we also call a nerve study. That can help aid in A, the diagnosis of carpal tunnel syndrome, B, if there's other underlying medical conditions such as diabetes, which can be contributing to the numbness and tingling, or if it's also coming from your neck. The electrodiagnostic study can also provide us with a baseline as to your nerve function. It's not always necessary to have an electrodiagnostic study. It's just a tool that we can use to help aid in the diagnosis of carpal tunnel syndrome. And it's also useful in terms of, for me, being able to counsel a patient on what they can expect if we move forward with surgical treatment. MRI of the wrist and CT scan can also be utilized, not as often. These are more useful in determining if there is a mass or something else going on that could be pushing on the nerve. Again, these are rarely utilized, but they can be useful in the diagnosis. Same thing with ultrasound of the carpal canal. There are some surgeons who are using ultrasound to determine if there's swelling in the median nerve, which is the carpal tunnel nerve. And then there's imaging of the cervical spine, which is useful in determining whether or not there's a pinched nerve in the neck. And then the other thing that we can do is just simply begin non-operative treatment. And that, to me, is the easiest way to start. Okay, and I briefly discussed the usefulness of the other studies, such as electrodiagnostic studies, the imaging studies, and the cervical spine workup. But really, beginning non-operative treatment there's good evidence to support this in assisting with the diagnosis of carpal tunnel syndrome. And I'm going to go over the non-operative treatment in a moment. So non-operative treatment can include activity modifications. So if you're somebody who is doing a lot of repetitive activities and you're doing things for hours on end, we would talk about maybe modifying how you do that. So incorporating breaks into what you're doing, or getting up and stretching, or positioning. A lot of us are now doing work from home, or our children are doing homeschooling. So we're all sitting in bad postures and bad positions. And one of the things that we can do to work together is to teach you how to set up a good ergonomic station. I believe we have a webinar coming up in the next few weeks with one of our physical therapists to discuss a workstation ergonomics, especially for those of us who are doing a lot of computer work at home these days. We can talk about the usefulness of anti-inflammatories or NSAIDs like ibuprofen, meloxicam, Celebrex. We can also talk about oral steroids such as a Medrol dose pack. And then nighttime splinting. Usually for carpal tunnel syndrome, I really focus on activity modifications, nighttime splinting, and corticosteroid injection. Now with people who have diabetes and the corticosteroid injection, I really like to make sure that they have an understanding that the corticosteroid injection may bump up their sugars for a couple of days after the injection, but then their sugars are going to go back to their typical level. But this corticosteroid injection is also very useful in making that diagnosis of carpal tunnel syndrome. And if later on down the line you need surgery, it gives us a good indication as to how you will respond to surgery. Now, the surgical treatment options, there's basically two surgical treatment options. One is the open techniques and the other is endoscopic. I will say most of my colleagues and I are doing open. There's a few who do the endoscopic. When it comes to the open technique, it's a same day, both of these are same day procedures. You come in, you do the surgery, you go back home. And there's some mild variations between surgeons, but in general, the limited or open is a mini incision. It's about this big, give or take a couple of millimeters. And you can have the surgical procedure done under straight local, which means we just numb the area, or you can have it done with sedation and local. It's very patient dependent. Now, if you've already had a carpal tunnel release and you have recurrent carpal tunnel syndromes, which can happen in a small percentage of patients, then we may opt for what's called an extended carpal tunnel release or a classic carpal tunnel release. And that incision goes from the palm of your hand and curves at the wrist and then comes further down. And the purpose of that is to make sure you have a good, thorough release of the carpal canal area. Again, that's usually done for revision carpal tunnel surgeries, or I always tell my patients prior to surgery that I will do it through a small incision, but if I can't safely do it through the small incision, I will go with the larger incision. It's very rare that that happens on the first go round if they're for carpal tunnel surgery. But if there is a need for a revision, most of us will go for the bigger surgical incision. The endoscopic technique, there's 1 and 2 incision techniques. I trained to do this during my fellowship, but I really don't do it in my practice simply because for me, it's quicker to simply do the mini open technique than it is to do the endoscopic. And in the end, there's really not much of a difference in terms of patient satisfaction and in terms of results between endoscopic and open releases. So in summary, there's a number of causes of hand pain, numbness, or tingling, and I hope I was able to glean some information for you in determining that if you've got numbness and tingling coming down your hands and into your arms, it's important to sort out, is this really coming from your hands? Is it related to a medical issue, or is it coming from your neck? Your story is very important, and that's why we're going to ask questions about a cervical spine issue, your medical conditions, and what have you. We want to know your story and how we can put the pieces together to help you. A good clinical exam can provide the diagnosis. Non-operative management can also confirm the diagnosis along with ancillary studies such as electrodiagnostic testing or nerve testing. And if you're having any of these issues, consider seeing a hand surgeon when the diagnosis is uncertain or if non-operative management has been unsuccessful for you. If you're interested in seeing any of us at Mercer-Bucks Orthopedics, please give us a call at the number listed on this slide. And at this time, I'm going to turn this over to Jen so we can go forward with the question answer session. Thank you again for listening in on this webinar.
Hello, everyone. Now it's time for the question and answer. And as I discussed at the beginning of the webinar, if you do have any questions, go ahead and click the Q&A button and type it in, and Dr. Zambito will be happy to answer them for you. Okay. You do have some questions. Do you see them, Dr. Zambito?
I do. Right now I have about 3 questions on the screen. Can you still hear me?
Yes.
Okay, wonderful. So I'll start off with the question is, what MBO locations do you go to? I go to our Lawrenceville location, our Hamilton location, as well as the Langhorne location. And then the next question is, where do you do the surgeries? I do the surgeries at Mercer County Surgery Center. Not everybody is a candidate for the having surgery done at a surgical center. And so if that is the issue, then I'll do the surgery at a hospital. Some of the hospitals where I go to for this surgery are Robert Wood Johnson Medical Center in Hamilton, St. Mary's in Langhorne, and Lower Bucks Hospital in Bristol. Those are the more common places. I do have privileges elsewhere, but those are the places I typically will go to. What is the recovery period for carpal tunnel syndrome? So that's not like a quick and dirty answer, but I'm going to give you the explanation I give all of my patients. So when I do surgery for carpal tunnel syndrome, it is a same-day procedure. You come in, I do the surgery, you go home that same day, okay? The incision's about this big. After the surgery, I do put a splint on people, which is a half of a cast. And the reason I do that is I want to try to slow you down from hurting yourself or hurting your hand. And then it protects, the half of the cast protects this part of your hand so that if you accidentally hit it, you're not going to be seeing stars after your surgery. That stays on for about a week. You come in a week, I take out the stitches, and then we start to teach you how to manage your scar. It's important to do what's called scar massage and desensitization, as well as nerve glide exercises. These are all things that you can do at home, which will help remodel that scar. Most people have a little bit of sensitivity here for about 6 weeks. The next question I get is, when can I return to work? It just depends on the type of work that you do. If you do administrative type stuff, you can go to work the next day. If you do heavy labor, then we're going to have a different type of conversation about what you think you can and can't do. So everybody's a little bit different in terms of their recovery time, but usually by 4 to 6 weeks, people don't even have pain where the surgical site is, and they're feeling great. The next question I have is, what are the preventative measures? So I kind of briefly went through that in terms of, we really want to assess what you do in your life and how you use your hands. And in terms of repetitive type activities, we want to kind of develop your habit of changing how you do things. So making sure you're getting breaks, doing some stretches. We can give you nerve glide exercises. Then the next question from the same person is, any specific gloves? I don't necessarily recommend gloves, but we did talk about the carpal tunnel brace. You can come into the office and we can either fit you with a prefabricated brace, or we can have our hand therapist make a splint for you. Usually the braces are used at nighttime. A lot of people tend to sleep with their wrists and hands like this, and that puts pressure in the carpal canal. So if we can modify that and make your hands and wrists a little more straight, that takes pressure off of the carpal canal and the median nerve. I hope I answered your question. And then we have another one. Do you usually try non-invasive treatments first or go directly to surgery? So I will say 90% of the time, it's non-operative treatment first. Unless somebody has severe carpal tunnel syndrome. On occasion, I'll get a patient who has already been worked up by another physician, and the electrodiagnostic studies show severe carpal tunnel syndrome, and there's muscle wasting right here in the hand. Then I'll talk to the patient about, are you ready for surgery, or do you want to buy a little bit of time? So most of the time it's non-operative treatment first, starting off with just the splints. I do have on occasion patients who come in and say they know they want an injection. Well, you know, we can have that conversation as well, splinting and injections. And it's the rare occasion that we go directly to surgery. Some more questions coming in. This is great. What are the best physical therapy type exercises or moves to ameliorate wrist pain? So it depends on what the wrist pain is. So we would have to see you in the office and sort through, is this a tendonitis? Is this a carpal tunnel syndrome? This question I love, because not all hand and wrist pain is carpal tunnel syndrome. So I would say, come see me and let's sort through this and figure out what's going on for you, and you know, see what we can do to help you. Let's see, my next question is, if after surgery and recovery, I go back to my repetitive movements, will the numbness return, or will surgery clear this up? So the short answer is surgery will clear it up. If it is indeed carpal tunnel syndrome that the problem is, if there's another problem going on, then we'd have to sort through that. On rare occasion, I'll get patients who, you know, the carpal tunnel release, after a carpal tunnel release, they get recurrent. I will tell you, the ones that I have seen in my 12 or 13 years of practice, usually are patients who have severe alcoholism and they develop a lot of scar tissue. And so I've had a couple of those that I've had to revise. Most of mine I haven't had to revise, but if you do a Google search to find out the most common cause for recurrent carpal tunnel syndrome, it's an incomplete carpal tunnel release. So let me go back. The short answer to your question is the numbness should not return unless there's a different source for numbness, like we mentioned during the webinar, which would be a cervical radiculopathy or a medical issue causing nerve symptoms. But hopefully we can sort through that before you undergo any type of surgery. That way we can counsel you better for surgery. So for example, sometimes I have a patient who has a cervical radiculopathy and who has carpal tunnel syndrome. For that person, I'll say, listen, we'll do the carpal tunnel release. The pain that you have at night that makes you wake up and shake your hands, that'll go away. But the numbness and tingling that you have in your hands may or may not fully go away because you've got some numbness in your hands that are related to your neck issue. So I really tried to sort out all of those things prior to moving forward with surgery, so that we can have a realistic understanding and expectation of what surgery is going to do for you. So that's part of the thorough workup of hand numbness and tingling.
Dr. Zambito, it looks like one just came in.
Okay.
I think, unless you just answered it. Is it typical to get carpal tunnel syndrome in both hands around the same time? Within the last year, I started getting numbness in both hands.
Okay, thank you for that question. So is it typical? I don't know how to answer that question. I would say most of my patients come in with one hand that they notice is really bothering them, and then the other hand that, yeah, it kind of bothers, but not really. So most people, so I don't think it's uncommon to develop it in both hands at the same time. There's usually one hand that's more bothersome than the other.
No, we have one more. You ready for one more?
We got a live crew here. This is great.
I know. If you do need surgery, is it safe from COVID?
Okay, so this is a great question because everybody's concerned about COVID, and I will tell you that most hospitals and surgical centers and even offices are concerned about COVID. So for example, when you come to our office, we will do COVID screening prior to your appointment. We take your temperatures, and then everybody's required to wear a face mask and also doing sanitizer on the hands. And then between patients, we really sanitize each of the rooms. So in terms of coming in to get seen, we do our best to meet all the guidelines that are available to us at this point in time. As far as surgery goes, at Mercer County Surgery Center, we also do the COVID screening a few days prior to the surgery. So all of the people who are scheduled for surgery, on top of undergoing the questionnaire type screening, will also get COVID tested prior to their surgery. In terms of our staff gets evaluated as well through questionnaire, temperature screenings, and in the surgical center, pulse ox screenings. So I would say it is as safe as we can get it in terms of prevention of COVID.
And if you're really concerned about COVID, if you would like, you can we did do a virtual walkthrough of what you can experience as a patient coming into one of our offices, as well as what you can experience as a patient going into the Mercer County Surgery Center. You would just need to go to those websites and click on the video, and you'll get an idea of what to expect when you get to those different places.
Well, we have one more question. This question is trigger finger related? Yes and no. Trigger finger is a tendon issue, and a trigger finger is inflammation in the the tunnels where our tendons, our flexor tendons run through. You can get inflammation in the tendon or the pulley area, and the finger sometimes will get caught like this and people have to open it like that. For those of you who are unfamiliar with trigger finger, that is a tendon issue. Now there are medical conditions such as diabetes in which people come in with both issues, the nerve issue, which is the carpal tunnel syndrome, and the trigger finger issue. So COVID testing nasal swab is not required before surgery at this time. It depends on where you're having surgery, okay? At the surgical center, I believe we're doing the saliva testing. Jen, correct me if I'm wrong.
I'm not sure about that one. I'm happy to get back. If you would like to send an email to programs@mbortho.com, just so that I have your contact information, I can contact the head nurse at the surgery center and get an accurate answer for that, because I'm not entirely sure what kind of testing they're doing there.
Now, if you have to have surgery at the hospital, I'm familiar with one hospital is doing the nasopharyngeal swab. So it depends on where you're having surgery in terms of your COVID testing.
Okay, I really do think that that is the last question. Thank you so much, Dr. Zambito. It was such a great presentation. Thank you for educating all of us on carpal tunnel syndrome and other hand conditions that came up. Again, as I told you in the beginning, if you have any questions, please feel free to email programs@mbortho.com. And between Dr. Zambito and myself, we will be sure to get back to you and answer any questions you have. Thank you all for joining us. We look forward to seeing you next time.
And Jen, can I get one more plug-in?
Sure.
Yeah. Next week, I'll be having another webinar regarding osteoporosis. So please join me next Wednesday, October 7th at noon to discuss better bones for better health. And then I also wanted to reiterate that we have one of the questions focused on exercises and what have you for carpal tunnel. I think one of our therapists is doing a talk on ergonomic evaluation as well, setting up. I can't remember when that one is, Jen.
I think that one is October 14th.
Yeah, so please join us in the next couple of weeks.
Yes, we have a lot of good ones coming up in October. Just keep an eye out on those newsletters that you get from us, and that will have all the registration information on there. It's also on our website at www.mbortho.com. All right, well, thank you so much, everyone, and we look forward to seeing you soon.
Thank you, Jen.